We're at the IAS meeting in Amsterdam. We're here with Vanssa Rojos and Yury Parra, and we really appreciate you taking the time because we're doing a series of programs that have essence around the subject matter of the conference attendees and also the organizations. And your organization has given you a grant, or an organization has given you a grant. So now you're affiliated with them as a fellow in the work you're doing. And can you tell us about the work you are doing and what caused you to get the grant?
Yeah, sure. So I actually decided to do the grant because I had done some extra clinical work at the end of my residency in HIV care, and I did it at Montefiore Medical Center in the Bronx with Peter Selwyn. He had been a long-time HIV provider and actually served on the HIV Medical Association board, and he told me about the fellowship, and so I decided to apply for it. And from there on, I kind of did a collaboration between the institution where I did my family medicine residency at Jamaica Hospital in Queens, and Montefiore. Actually worked with Peter Selwyn in providing HIV care, and also at another organization on Long Island in New York called Northwell Health. So each of the hospitals had a bit of a different focus, but all of them had HIV care as part of my clinical time that I spent there. So at my institution in Jamaica, it was more of an underserved population, and I was doing something a bit new since no one had ever done HIV care and primary care before in the past at the institution, so that was a first. And then while I was at Montefiore, I also served with a similar patient population, but under Peter Selwyn, seeing patients. And then on Long Island, that was a very interesting program because it was a program for children and adolescents affected by HIV. So I worked with David Rosenthal and oftentimes saw children who had been perinatally infected. And also, I also worked with his patients, his PrEP program, and also some of his transgender patients. So I was able to really get a breadth of different aspects and areas of HIV care throughout the year.
And this is the work you're going to be doing going forward?
Yes, I will be doing HIV care going forward.
Right.
Mm-hmm.
Yury?
So I decided to go into family medicine and also with my goal of caring for vulnerable patient populations and always bringing the social justice mindset to the work I do. So when I found out about the HIVMA Clinical Fellowship, it seemed like sort of the perfect opportunity to strengthen my skills in order to be able to care for vulnerable populations, but I also learned much more about HIV. So the way that I created the fellowship with the support of the grant is in Philadelphia at Thomas Jefferson University is where I did most of my fellowship, but I had the opportunity to go through several community centers in Philadelphia. Philadelphia is currently one of the cities that is highly affected by HIV in the US, and so I had the opportunity to not just rotate an academic center, but also go to fairly qualified health centers and be exposed to different patient populations, patients affected by substance use disorder, homelessness, patients of immigrant backgrounds. And so through that different rotations, I had an opportunity not just to learn the medicine of HIV, which is important as a provider, but also to understand the context where it develops, and so really see the interplay of the social determinants of health and HIV. So that has been always very, very important for me to understand. And being an immigrant myself, is something where I wanted to understand that in immigrant communities as well.
So how long have you been in doing this work?
So family medicine training was about 3 years, where it sort of started back through medical school, and even before deciding to enter the medical field, I always had focus in public health and sort of social justice. The work in terms of HIV, I would say over the past 2 years that I have been more involved in terms of learning and understanding it.
Do you both believe this is, take it one at a time, but do you both believe this is a field that you really want to stay in, or do you have, okay, this is a step to something else, no?
No.
This is
No,
this
this
is
is, we both could have started to work right away out of residency, and we decided to go for more training because of, and I say myself, for the social mission. I really believe that this is a field that really empowers people, and I feel like I have the privilege to be a voice for many people who don't have access to the resources that we have. So I certainly kind of believe in that concept of being a bridge between the communities, our patients, but also between sort of this set of resources, medical field, government, advocacy. So for me, it's a choice, and I think Vanessa would.
Yeah, for me, it was the same way. I could have started working right out of residency and not had to do any more training, but I decided also to do the fellowship and actually immerse myself in the training. And it's not necessary even to become an HIV provider to do the fellowship, but I really wanted to become involved and learn about the different aspects of HIV care and really become involved in the social aspect of it, because I don't think that you can speak about HIV care without including the social aspect. And you know, in my family medicine residency at Jamaica Hospital, it's ingrained in our program, and so it just was almost like a natural transition to doing it as a fellow.
Now, where I come from, you know, 35 years ago when this disease was grim and people were dying, and people didn't live with this disease normally. Today, people are living with it, but so our sense of where we come from as becoming activists was different than yours, but I'm just trying to get the perspective. There's still, I would say, people are still suffering. There's still grim days for people. People are still poor. People are still not accessing health. So is that pretty much what stimulates your, I would say, activism as a
Yeah,
field?
for me, it's definitely a huge part of the reason that I decided to do the work. I mean, I started working with the patient population, you know, as a medical student, as a resident, and then I decided that I wanted to further get involved in doing HIV care. And like Yury said, it's been a huge passion of mine to work with, you know, those who are suffering and stigmatized is a huge.
There's a lot of baggage.
Yes, there's a lot of baggage, and I oftentimes feel for the patients when they're telling me about these stories where, you know, they're getting evicted from their apartments because, you know, they're in a same-sex relationship, and so that really, you know, drives my passion a lot of days.
Right. I'm guessing that it might be very similar for other people as well. I mean, you're not unique, but I say I certainly respect you and admire you for the work you're doing, because we need that. We definitely need what you're doing. And that's the reason you got the grant.
Yes, thank you.
And I wanted to add sort of when we both enter family medicine itself, because it combines not just medicine, but the social component, the behavioral. And so kind of going a step back, we entered the field, but a lot of the providers, a lot of the residents that are in that community have that mindset. So it also has been excited for us to do this fellowship because we have been able to impact a ton of physicians in training. I can say in my residency now there are a ton of residents that are thinking, okay, how can I get more training? Can I do a fellowship? Or maybe I will just go to the conferences or do the training while I'm in residency. So HIV has become a chronic medical condition. And so it is totally within the care of primary care, but it also has to do with access, looking at the patient as a whole. And so that is part of helping motivate more physicians to enter the field that we are. They don't necessarily have to do a fellowship, but they really need to understand the principles of caring for the patients.
And a lot of background there, a lot of history.
Yes.
Yes.
We thank you so much for doing what you're doing, and good luck.
Thank you so
Thank you.
much.
Thank you.